Thank you, Mr. Chairman, and thank you for holding this hearing. Thanks to our witnesses. I would, for the record, Mr. Chairman, like to submit an article, Mothers Are Dying in Childbirth, Why Isn't Anyone Talking About It?, by Susan Campbell and Christine Stewart.
So ordered.
I'd also like to both thank the chairman, and I would like to thank the Republican leader as well, and the everybody here on this panel. I think this stands in stark contrast as a hearing, speaking of people talking about it, to what has taken place in Alabama. And so I appreciate the witnesses and the desire. I want to go back to something that Mr. Brady said. You know, the goal here should be to eliminate. And the CDC has recently issued a report that said these can be reduced by 60%, but that leaves in my mind that means that there's 40% more that this is impacting that we can't get our arms around. And it's this incrementalism that really disturbs me, as I know as much as it disturbs everybody here. And I'm wondering, because I know there may not be a silver bullet, but certainly there's got to be the following steps that need to be taken immediately to eradicate and eliminate this. Dr. Liu, I'll start with you. Do we have steps that we could take immediately?
Yeah, I think the first step is for y'all to call for a national strategy to eradicate maternal mortality, which I think it's long overdue. No,
So, for example, having a national task force that was dedicated and focused on this with all the nation's leading experts to say the goal is we are going to eliminate this. We're not going to be, you know, what is a woman in my district has 3 more times a chance of dying than a person in the United Kingdom or in Canada. And even people in China and Saudi Arabia fare better than Americans do. If this isn't a call to arms, I don't know what is. And instead of focusing on eliminating the Affordable Care Act, we ought to be talking about how we can provide more health care and better access to people. Is that part of the solution?
Yep, and so I do think starting with that national strategy and making sure that we're aligning kind of resources with the strategy. I remember first kind of reading about the maternal mortality crisis in this country, in the wealthiest kind of nation on earth, when I was a medical student. And this problem's been going on for such a long time, and the problem's been getting worse over time. And But we're now finally in that historical moment where it seems like the nation is coming together to finally do something about maternal mortality. And so I do think it's important for y'all to call for a national strategy to make sure that we have that first ever comprehensive national strategy to eliminate and eradicate maternal mortality in our generation.
Dr. Harris?
I agree with the national strategy, but I agree that we can do some things right now. You heard folks talk about the AIMS work and the work of the Mortality Review Committee, so we can know immediately what's causing the problems in particular localities and try to address those. And then, as I've said,
as a follow-up, would you say in written statement to us, I recommend you do the following? Dr. Robinson?
Yes.
What would you recommend?
So I agree with my colleagues on the panel, and I would say also the extending of Medicaid provision up to 1 year postpartum for women to make sure that after that 60 days or after that 42 days that women are still able to get medical care to help prevent those deaths that we know occur in that postpartum period.
Dr. Hollier?
Implement the AIM program in all 50 states and all of our hospitals so that everyone is implementing the best practices.
Dr. Rouse?
Absolutely implementing maternal mortality review boards in all the states so that we are able to assess what the problem is. And once we know what the problem is, we can work to address it.
Ms. Felix, you should be the national face of this.
I think I'm the only one up here who's not a doctor. So I'll have to agree with all of them.
Good answers.
Thank you, and I yield back, Mr. Chairman.